I'm going to introduce myself and Nick McGuire, who's joining us today in leading this informational session. My name is Liz Fry. I'm a psychiatrist in Atlanta, and I'm on the board of the Street Medicine Institute. I've been participating in something related to street medicine for the past 11 to 12 years, I believe. And kind of in thinking about what could I offer during this time, because I'm not currently out on the streets. I have been thinking about just all of the challenges that we're all kind of navigating as we're trying to take care of our rough sleeping friends. And kind of knowing from emerging data that's coming out about the toll that this pandemic is taking on healthcare workers, I thought it would be especially important that we as the Street Medicine Institute offer some sort of programming to help, support and maintain all of our mental well-being, and to work on kind of building our muscles of resilience. So that's the background for why we're doing this today. I want to thank Nick McGuire for joining today too. Nick, how long have you been doing street medicine work?
I don't know. It's that long.
So Nick is a clinical psychologist in the UK, and I know you've been involved with the Street Medicine Institute since before I joined, I think, but he has graciously offered to collaborate with me and some others on this project, and really it's I think Nick's expertise in this area that we're relying on here. But so thank you so much for joining us. And then I also want to thank Corinne Yorick, the chief coordinator of the Student Coalition. She has been really helping a lot in the background to identify resources and to help put this together. So thank you so much, Corinne. And then just to let you all know, this is the first in a series of sort of webinar and discussion sessions that we're going to do. Our next one is going to be on May 14th, and you'll get an email about that, and there'll be more information on one of the last slides about it. We are also developing some small groups that are sort of geared towards those of us doing street medicine, hopping on a small group Zoom every so often to just offer support to each other, and to help, just help us all maintain our mental and psychological well-being, even, no matter what kind of challenges we're facing. I think in talking amongst the three of us, Nick and Corinne and myself, we've identified that, there are a number of us who are kind of sheltering in place at home because either we're in a high risk category, or the schools aren't letting our students go out on the streets right now, or for those of us who have been on street medicine teams before but aren't currently engaged in one. And then I think there are those of us who have maybe shifted our position so that we've shifted indoors, either into shelters or into hospitals to provide care. And then there are still those of us who are out on the street. I think we can see some of our friends out on the street at this very moment, or in a camp. So just kind of giving that context to say that we're all in a little bit of a different place with this, but we all have, I think, our own challenges that we're facing in each of those areas. But also to recognize that for some people, this may be a really awesome time right now. And I think, maybe even especially for our unsheltered friends who are now getting a free hotel room and grocery deliveries to their doors every day. So it's important to kind of think about the wide breadth of the experiences for everyone now. Okay, so I'm gonna start the PowerPoint portion. It's gonna be pretty brief, and I can share my screen with you. Okay. So can everybody see that, the PowerPoint? If you can't, Corinne, just say something in the chat and Corinne will help you. Okay, so I think I've already gone over why we're doing this today, so let's get started. And I've already actually talked about this too, but this is just some of the programming that the Street Medicine Institute is offering during the COVID-19 pandemic. You guys may have already seen our COVID-19 guidelines for street medicine teams during the pandemic. That's really geared towards how do we still provide street-based care and how do we do it in a safe and effective way while we're working in the streets. And then, like I said, we're having a webinar and conversation series, the small group Zoom calls. And if you haven't responded to the survey yet, there's a link to it in the chat. And then we're also just going to be having some virtual social gatherings to connect us to each other around the world and just hang out and spend time together, because I think that's maybe one of the most important things that we can do right now to improve or maintain our well-being and improve our resilience as well. It's just to spend time with people we love. Okay, so what do we know about the impact of the COVID-19 pandemic? And in order to think about that, we look at what's kind of the impact of other past disasters and pandemics. And what's been pretty well researched and I think shown well in this picture is that the psychological impact or the psychological footprint of any disaster or pandemic is going to far exceed the impact of like the sort of medical footprint. So that medical footprint includes people who get sick from COVID-19, and then also I would include in that all of the folks who are not seeking care that they might really need right now because they're afraid to go to the doctor or go to the emergency rooms. And so there are a lot of health issues that are being impacted by COVID-19 that aren't necessarily COVID-19 related. But I think larger than that, and this picture shows it pretty well, is that many of us will not catch coronavirus and will not have COVID-19 symptoms or, problems related to other chronic diseases that we're not getting treated for. But the anxiety about working through this very different time that our whole world has kind of changed in the blink of an eye, and the anxiety related to that, but even less so than anxiety, just maybe the feeling of not being very settled or having a difficult time, or even just the effort that it takes to make such a big change in our lives, I think has the potential to impact all of us. So let's move on and just kind of look at the phases of emotional responses to disaster settings. And so this image really shows us kind of a general sense of what happens in a disaster, that as people and as communities, we generally tend to follow this kind of line in our emotional response. But for any individual person, the course of this is going to look very different, and that we're all going to be sort of in different places at different times on this too. I think the other thing to note is that this image shows kind of a single impact, which is the case for a lot of disasters. But in a pandemic, there's really no one single impact, whereas there are multiple impacts happening throughout time, and that the impacts that are happening are not sort of global or universal, that different places in the world are experiencing impacts from the pandemic at different times. And so that's going to kind of change our emotional responses. So, that me here sitting in Atlanta, my course through this is going to be pretty different from one of our street medicine colleagues, sitting in Nigeria right now. And so I think we have to keep that in mind. But just to kind of go through this and what these things mean. So the pre-disaster is sort of like, we know this is coming. We can see it coming towards us. It hasn't hit us yet. That, maybe our country or our local community, or, wherever we live hasn't had its first COVID-19 case or hasn't had its first COVID-19 death. But we know from the spread around the world that, and spread sort of locally within communities, that we're in this, like, we can see it coming, but it hasn't hit us yet. And so this is kind of, there's a warning, we have time to plan and prepare, but we haven't hit that impact point yet. So then the impact point, and like I said, there are sort of really multiple impact points during a pandemic compared to like a natural disaster, for example. But the impact is kind of when we get either initially hit by kind of the first wave of COVID-19 deaths, or the initial waves of the kind of increasing community spread of COVID-19 within our own communities. And what we see in response to that impact is this kind of heroic response. And I think we've, here in the United States, and seen that, especially that heroic phase in New York City, where kind of, the nurses and the doctors and the other clinicians working in the emergency rooms in New York City are being viewed as heroes around the world, who are kind of seen in a way as superhuman in combating the pandemic. And what happens with that for many people in a community is that as we mount this kind of heroic response to the disaster, it brings our community together, and we feel more connected than usual, and we feel more cohesive. And this is a really wonderful feeling that, wow, in the face of this horrible pandemic, we're all coming together to make things work. And then after that response is when we start to see the downturn into disillusionment. And I really want to emphasize here that different people experience the disillusionment at different times. So just in thinking again about New York as an example, what I have read in the media is that while the rest of the New York community may still very much be in this honeymoon phase, I've heard accounts from a number of healthcare providers in New York City that they don't feel like heroes, and they feel like they're failing in the face of a really tough time. And they may feel like they don't, that time of not having enough supplies of what they need to protect themselves and others, and not having enough resources like oxygen and ventilators and things like that, that partly that distribution of resources and then our own personal factors may tip us into disillusionment at different times. And so even within our own communities, we're all experiencing this cycle a little bit differently. And then over time, and I've seen the Reconstruction period being maybe even 3-5+ years period of time, we develop a new beginning. And this is the area of kind of post-traumatic growth. So I think that we have that to look forward to, but it looks pretty distant right now. The other thing I will say is kind of, I alluded to this earlier, the COVID-19 pandemic may be very traumatic to a lot of people, but to other people, it may not be a trauma at all. It may actually be a really wonderful time in their lives that, our friends who have been who have felt neglected and uncared for and unsheltered for so long now have a hotel room that they get to be by themselves, and they have groceries delivered. And that may be a really wonderful time. Similarly, my 6-year-old told me yesterday that he really loves this time right now because we all get to be together as a family. And he's not looking forward to the point at which he has to go back to school and we have to go back to work in person, just because it's been so nice for him to have everybody at home right now. Okay, so this slide is courtesy of Dr. Nick McGuire, to just show that, like, this is what it actually feels like, this kind of emotional roller coaster of a pandemic, and that everybody's emotional roller coaster will look somewhat like spaghetti, and that it'll be a different type of spaghetti for everybody out there. And so while this slide is really nice in thinking about how we transition over time, again, any one person's experience of it is going to be a little more like this. Okay, and then so last of my slides, and Nick, I'm sorry I'm taking so long here, but I just wanted to go over kind of the different categories of psychological and behavioral responses to disasters and pandemics. And some of these things may overlap a little bit, you know, just because we have a distress response doesn't mean that we won't ultimately fall into the resilience category. So kind of important to remember is that the vast majority of us will develop a resilience response. We will be resilient and we will be okay in the face of this pandemic. A number of us will have distress responses, but still the vast majority of us may not even have a distress response. Some of that distress response may be things like having a lot of bad dreams, difficulties falling asleep and staying asleep, feeling unsafe or really vulnerable, maybe even having some somatic symptoms like more headaches or stomach aches or things like that, or maybe even things that make us think that we might have COVID-19. So all of a sudden the cough that I've developed because I have allergies at this time every year now makes me think that, oh my gosh, maybe I have COVID-19. And then I think there's a lot of irritability and anger in response to any disaster or pandemic. And a lot of times that can be interpersonal, that we're just more irritable with our friends and family, or it may be an anger towards our organizations or our government for feeling like they're not doing enough to prepare us or to support us during the pandemic. And then with all this going on, it's just so easy to be more distracted than usual. Some of the health risk behaviors, increased use of alcohol, tobacco, marijuana, and potentially other drugs as well. One thing that I've certainly noticed in myself is this sort of over dedication response where I would go to the hospital for 6 hours a day and then come home because I had to help take care of my kids, but I would be sewing cloth masks to help the local area hospitals put over their N95 masks to prolong their use. So I just felt this constant like vigilance of needing to help all the time. And that's a risky response too. And then some of us might, even though we are in a period of time in which social isolation is more encouraged, you know, there are still many ways that we can connect with each other. And so even in a time of, you know, physical distancing, we don't have to be socially isolated, but some of us may tend towards that anyway as a response of, I'm just going to draw in because the world around me feels unsafe. And then also an exacerbation of interpersonal conflict, whether it's with, you know, our partners at home or our coworkers or whoever, that may happen. some people, and different people are at different risks of developing actual psychiatric disorders related to their distress and health risk behaviors, but common psychiatric disorders resulting from pandemics are depression, post-traumatic stress disorder, anxiety, and complex grief. And complex grief, it's Nick could probably describe this a little bit better than me, but it may even include things like suicidal ideation or thoughts of wanting to be dead in response to the grieving process of others around us having poor outcomes or dying. So I'm going to turn it over to Nick now, and he's going to share with us what is resilience and how can we build it?
Thanks, Liz. Appreciate it, and also appreciate the opportunity to be part of this this process. So we can often think of, I think the term resilience comes from material science in origin. So thinking about something that kind of springs back to shape. A resilient material is one which can spring back to existing shape, and so that's been adapted by the APA to this idea of a process of adapting well in the face of adversity or trauma or tragedy. So this idea of adapting and being able to survive and being able to maybe even more than that. You know, there's this sense of post-traumatic growth. So some people describe processes of actually making improvements to their own kind of resilience, their own mental health over time despite traumatic experiences. Not static, so resilience, it does change over time. And partly it changes over time in relation to the environment, which we're going to talk about in a minute, but also we change. You know, we change in the way in which we respond to difficult situations, the amount of anxiety we experience in situations. There's a process called habituation where, you know, the first time you jump out of an aeroplane, it's massively anxiety provoking. The next time, not quite so much, and the next time, not quite so much. So the more we engage in difficult and worrying situations, the more resilient we get because we habituate to those situations in the main. So resilience can be really usefully considered as a function of the interaction between the individual and their environment. Now, sometimes some organizations make the mistake of placing resilience in the individual. And some organizations which perhaps don't care for the well-being of their staff can do that. And so when things go wrong or when stresses and strains start playing out and burnout starts playing out, those kind of organizations can then blame the individual for just not being resilient enough, not being strong enough. Very important that we frame resilience as this interaction between the two, because we cope with things in our environment. We cope with people getting ill, whether they be loved ones or whether people we're caring for. Things happen in our environment. And this is, as Liz was saying, this is unprecedented, or not unprecedented, within our lifetime. There have been a number of pandemics in a number of lifetimes, but this one seems to be particularly difficult. And it'll be maybe 3, 4, 5 generations before maybe something like this happens again. So our environment is really, really important. So resilience doesn't sit in the environment and it doesn't sit in the individual. It sits in this interaction between the two, how we cope with things that happen in our environment. It's massively important. Not innate, although some people can have a kind of a genetic predisposition to it in terms of arousal. Some people just get wound up more quickly than others. Some people are more prone to anxiety and arousal than others. There's just a normal curve within the population. And we can develop it. We can practice it. As Liz was saying, we can kind of think of it like a muscle. It's something that we can practice. The more we engage with difficult situations, the more resilient we get. It's just the feel the fear and do it anyway. The habituation process. The problems come when we try and avoid difficult situations because we never learn that we can cope with them. And avoidance is kind of almost like the enemy of resiliency. Resilience is about becoming stronger through experiencing difficult situations. Thank you very much. So, well, how do we do this within street medicine then? Compassion, I think, is a key. So compassion for ourselves and compassion for others. Now, we kind of use the airline model here, where they talk about putting the mask on. If a cabin depressurizes, you put the mask on yourself before you put it on others. That has to happen. That has to be a truism. The more compassion you can build for yourself, the more compassion you'll have for others, and the more you'll have available for others, because your sense of security and your sense of purpose can improve with that self-compassion. So building it for yourself and being kind to yourselves, to ourselves, is massively important, and I think it's a foundation for resilience. One of the things we may be able to do, this is why the environment's important, is there may be things that we can do within our environment. So PPE, for instance, is something that we do within our environment. It may make us safer. Distancing is a way in which we're manipulating our environment to increase our sense of safety. And it may be actual safety, it could be sense of safety. So there are things that we can do externally, behaviorally, to increase our sense of feeling safe. And then there's this sense of self and team efficacy, how effective we think we are. Now, it's massively important. One of the things that we've found repeatedly, which contributes to burnout, and particularly tipping over into the kind of the disillusionment thing, is not feeling effective anymore. We don't think we're effective. We're going to unpack that in terms of values in a second. But ensuring that we develop and bring into awareness is the really important bit, is bringing into awareness. Because sometimes we don't feel effective, we don't believe ourselves to be effective because we're not looking for where our effectiveness lies. If we're looking to fix people, if we're looking for people to skip off into the sunset, that very rarely happens. It's the tiny little increments of change that we may be looking for. Somebody may be starting to agree to, well, okay, I will go, I'll have a think about going to that hotel, or have a think about going into that place. But you lot can log off because, I'm not going to do it now. Now that's a success. Having somebody even start to talk to you about change is massively important. But we sometimes we're not aware of it. So we need to help our team members, and our team members need to help us. It comes back to this, this social process that Liz was talking about. It's very important that we help each other see where we're effective, what even the tiny little things that have changed are. The connectedness, the relationships, it's huge. It's huge. And particularly through accepting teamwork. In other words, sometimes we're not going to be at our best. When we're stressed, we're not at our best. The accepting of those things. So when we're not at our best, our team's accepting that of us. And then when our team members are not at their best, accepting that of them. It's very, very important. We're not all going to be able to behave really well all of the time. But most of the time, that's great. So the accepting bit's really important. Hope, we always have to focus on hope. And we know we carry the hope for the people we're working with. So finding and focusing on it, remembering it. And again, this is a social process. We can be reminding each other of it. We're all capable of forming very negative internal narratives about ourselves, how effective we are, how worthless we are. Really, really important to notice those. And again, talking to people. So the connectedness enables us to, if we feel close to people, we can talk to people about what we're thinking about ourselves. And this is almost the adverse of compassion. Compassion is the kindness, it's accepting that we're not always going to get it right. And that's important. The focus on ourselves and the thoughts about ourselves as worthless and stupid and incompetent, particularly incompetent, we really need to be noticing those and talking to people about it, so that they become not facts inside our head that we hold, I am an incompetent person, but a thing that I have thought. It's just a thing, it's just a thought. And of course, we're always doing the best that we can. And also bring aware of continuity. Now, we tend to sort of categorize things. We think in terms of either or. And there's at the moment a sort of a rather unhelpful sort of battle fighting military kind of narrative, which is kind of contributing to that. This kind of narrative can be really helpful in the heroic phase when we're talking about fighting and battling things. If we move over into that disillusionment phase, then the battle is lost, the fight is lost, And the problem is we're bifurcating. We're thinking either or. It's not about that. And I think sometimes reminding ourselves about the continual narrative from the words. So we're developing ways of dealing with this thing. There's no cure at the moment, but we're improving, we're caring, and we're helping. Those kind of things. As Liz was saying, we have the same thing in our country of care providers sometimes thinking, well, I don't feel terribly heroic at the moment because 4 people died in my care today. That's not terribly heroic. And remembering that actually, this is an environmental thing, and we've got an R number which is kind of waxing and waning, and that there are some things that we can't do. We can't fix everybody, we can't cure everybody, not everybody's going to live. And remembering that actually that maybe because of the care that we gave, it was only 4 people, it wasn't 8. The kind of the continuity of thinking is massively important. Thanks, Liz. So what are we doing then? The physical stuff, remembering the physical stuff. Eat, sleeping, resting. Really, sleep, really important. There's a danger in the heroic phase of thinking we don't need to sleep, we're on it with massive adrenaline rushes. And that can pay a big toll. So the resting, the eating and sleeping, trying to get our diet even vaguely okay is important. Exercising wherever possible, remembering not just the endogenous endorphin stuff, but also breaking away from a set of visual cues. One of the problems with lockdown is that the visual cues that we have remain kind of fairly consistent, and if they start to get associated with things like low mood, you need to break that habit. You need to break the visual cues, because the visual cues get classically conditioned, which is the technical term, to low mood. So if you start feeling low, you have to vary your environment, and particularly the visual cues. There's something about metacognitive awareness, which we talk about a lot, and mindfulness is a great way of enabling metacognitive awareness. So metacognitive awareness is this idea of noticing our own thoughts, moving from I'm an incompetent person to I have had the thought that I'm an incompetent person, that I have no value, that they died because I wasn't able to do anything. And mindfulness, a lot of people use mindfulness. For those that don't, maybe thought challenging can be another way of doing it. Well, hang on a sec, would my friends say that actually I am incompetent? No, they wouldn't, because I've done this, and this today. That's not incompetence. So 2 ways of enabling metacognitive awareness and being able to think about your own thoughts. Reflective practice is another way of doing that. And we'll talk more a bit about that later. Small groups, normalizing each other's experience. It's not just us who have these thoughts. It's not just us who feel like that. That's a very important part of reflective practice. And spending time with people that you love and the people that you value, and remembering what's important in life is a huge thing. For a lot of people, will have religious or other spiritual practices, really, really important. If those are the things that you find caring and you find enable you to build compassion as well as spending time with your loved ones, then that's really important. And I guess the principle there is maximizing, a very technical term, maximizing behaviors in the service of your values. So what is it you value? If you value your family, maximize the time you spend with that. If you value a belief, maximize the time you spend remembering to engage in those practices. And also notice when your environment won't allow it. There are times, particularly, if you're working with very ill people and you value caring and you value saving lives, and that's part of you, your environment is not going to allow you to behave according to that value, because people are going to die. There's no 2 ways about it. And people aren't going to get well in a way that perhaps you tie to your values. So it's worth being clear about what you value, and not just blaming yourself. Again, the compassion, this is why compassion is such a foundation of this, is being compassionate with yourself when perhaps you're not able to behave in service to your values, because your environment might not let you do that. So, and in terms of sort of, crisis, we talked a bit about ensuring safety in terms of the kind of the physical stuff, the emotional stuff, massively, can be traumatic, but as Liz has said, not necessarily for everybody. But talking to each other and helping each other process the emotions through talking is a very, very important part. Leading by example is huge. If you're a leader, or you don't just have to be a leader, but you can lead by example through not just behaviours, but by who you are. Talking a little bit about, the inadequacies that you feel and you believe and you notice, because once they're out there and they're talked about, they lose those kind of thoughts, and those difficult thoughts that we have. They lose their power. They lose the power to have that emotional bite. Sleep and emails. Don't be emailing late at night. Save your emails so that people can see that you are taking time off, and there's a kind of a shut off time. If some of us, we do tend to work late, but sometimes you can set emails to go at 9 in the morning rather than, or 8 in the morning rather than at night, so that you're modeling this idea that, yeah, I am shutting off, I am taking my time, and I'm not working, or I'm not indicating that you need to be working, particularly if they're juniors. Seeking your own mental health systems, that's massively important. And then the being open bit, letting people know that, yes, of course I'm struggling, because if we try and present this perfect edifice of coping and competence, it's just going to have a massive impact on the people around us who can't sustain that. So helping people to see that you're not this massive edifice of competence, that you do get things wrong, and that we do have failures, can be incredibly useful for other people around us, who then stop ascribing perfection where it just doesn't exist. And seeking help, making sure you're seeking help and helping others to do the same thing. Team cohesion is really important. So helping people to articulate why they're doing what they're doing, why maybe a team may have some common values. What's the common stuff that you're working to? Why did you get up this morning? Right, what is it that we're going to be doing together as a team and interdependent on each other that's going to achieve that? People have different skills within teams. Not everybody's good at everything, and nor should they be. A team needs to be a good mix of people with different strengths and weaknesses. Being able to acknowledge those, that maybe Ida might not have that strength, but she does, is a really useful thing, and it promotes team cohesion, because everybody can feel their value and understand their value within the team. And it can be as simple as just telling people where their value is, what they've done, and when they've done something that is a great job. Making space for grief. Sometimes, particularly in this heroic phase, people can forget to make time, and forget to make time for people to grieve, and for people to talk about those difficult things that they've experienced. But that's exactly the time when we need to do it. We need to process it, and we need to honor is a good word. Honor the difficult things that people are experiencing. Psychologically, we would call it validate. Show that actually that's whatever you're feeling is entirely valid and it's entirely okay. And the forward thinking, being realistic and hopeful. Hope, we can never lose it. So this is you, Liz, but I'm just going to say that I am going to post in the chat a really nice, I've already done it. I think I've done it. Yeah, I have now. There's a guy called Russ Harris who wrote The Happiness Trap, and he's done a kind of a COVID specific YouTube video that's worth watching. It's really nice.
Great. Thanks so much, Nick. So just to remind everybody before we go into our discussion that our next webinar and conversation in this series is going to be May 14th at noon Eastern Daylight Time. And that, in thinking about how we as leaders in our street medicine teams, leaders in healthcare and in our communities can do things to build resilience within our teams and our communities and within ourselves as well. And so that portion is going to delve more into how can we be effective leaders during this time? We touched on it. There are a lot of things that we're going to build on in later later components of this series, but we wanted to give an overview today. So we'll delve a little more into the leadership part of it next time, and we'll send out an email about this. Again, the small group calls that we're going to be doing through Zoom are really going to be for those of us doing street medicine to support each other as peers through this time. And so whether you think you're doing fantastic right now, or whether you think you're not doing fantastic right now in terms of kind of your overall mental and emotional well-being, I think that there's research to show that having these kind of peer support groups can build resilience and promote well-being. You know, emotions and well-being is not a static thing either, and it dips and dives. That if you're a part of, I think, one of these group calls, that the group will be there for you when you are going through a dip, and that you can be there for others when you're going through a high point. In about 15 to 20 minutes, we're going to start just some social time, because I think that, again, being with those people who we love can be really important in promoting well-being. And then also, we're going to have some resources for resilience building, both within ourselves and in our communities, on the Street Medicine website soon. There are a few resources that I've listed here. We're going to make the slides available for you all. I'm going to get trained in psychological first aid, just so I can know more about this process. Surprisingly, or maybe not surprisingly, medical school and residency, I don't feel like, taught me how to promote well-being, but rather how to treat a lack of well-being. So I'm going to educate myself on that. And then also, just there's some additional resources for people who are having difficulty sleeping during this time. And a lot of it's about sleep hygiene. And I think most of us have been promoting sleep hygiene among the people that we treat for years, and yet maybe aren't necessarily great at doing it for ourselves. So again, these slides will be available. And I'm sorry that we've taken so long here. I think we want to go ahead into if I can, sorry, having trouble figuring out how to stop sharing my screen. There we go. Okay, so if you have a question or want to bring up something to kind of talk about on the variety of topics that we've touched on, then you can unmute yourself down in the left-hand corner of your screen. If you are not responding to a question or not asking a question, then I'd ask you to keep yourself muted, just so we don't hear, your dog barking in the background and children playing in the other room, things like that. So does anybody have anything that they want to share, or they want to know more about or talk about?
Hi, it's Richard Doan. I'm calling from Toronto. Hi, Liz. How are you? I'm supporting virtually basically a shelter that's been converted for a place who are close contacts of folks who are homeless, who are COVID positive. So it's their contacts. And one of the things that's interesting, and I'm curious what the group will say, folks get to stay there, of course, for about 14 days. Some of them will become COVID positive, of course, and then they're transferred to a different location that's strictly for folks who are COVID positive, where they'll have their own room and be looked after. But then there are some who kind of go back to where they came from. In other words, if they're COVID negative, they get through the 14 days. They have no symptoms. They test again. They're still negative. They're sent back to, well, the original shelter where they were, or something like that. And I'm just wondering, has anyone had any experience of, one, what it's like for clients in that regard, to like, on the one hand, it's very confining, but you're in a situation that's relatively safe. You're relatively looked after. And then boom, you're just back to where you started, and all the risks that you were exposed to before kind of resume. How that feels for them, the folks who are experiencing homelessness, but also how it feels for the staff. Because I'm just kind of imagining in my head, you get someone through a difficult time and then you say, I guess this is where the bus stops, so everybody off. And how that might feel for folks. And I wonder if anyone's had experiences similar to that, working with clients in this sort of setup, and how things have rolled for the clients and for staff members who work with them.
Drew, I saw lots of head nodding. I'm going to unmute you.
Yeah.
I wonder if you might share your experience.
So I'm calling from Portland, Oregon, and in my paid job, we have this exact experience. From the patient's perspective, it's interesting. It's twofold. One, some of the patients are just so used to this. This is no different than them being in the hospital for 14 days and then getting booted right out. It's a little bit more intense for them. So some really get it, and this causes extreme anxiety, suicidality, and then like kind of overwhelms the entire system. And I think it's been more of an impact on the staff, that they have really struggled, and we're already starting to see that burnout and that irritability from them, and that, like, sort of from the get-go when they show up in the hotel, sort of like guardedness and that lack of connection that they're having with some of the staff there. So I think it's interesting that the resilience of the staff is very much tested, and we don't have a great support plan for them. And then I think for most of the clients that we have, their resilience is like, they're fairly used to it as long as they know ahead of time. And like, it is very distressing. And I think I share with them, like, this is going to be tough, but this is what we have right now. This is, we're sort of the messenger of this system. And they've been really understanding of that when we tell them up front, for the most part. But that's been a huge challenge and a huge emotional distress that I think I share, and I'm barely doing direct practice. I'm supervising all these teams. But I think that's that's a concern I have, of how long will that go, and we're not building great resilience for our staff or for the patients, really, because we're, hang out in your room and isolate there. I think that's a huge risk we face here soon, and we'll start to see it sort of crumble. We're in that downhill phase. The honeymoon is over, and reality is sinking in. Has been my experience.
Yeah, I'm not been on the streets recently here in Atlanta, but a few years ago, I had been working with a guy out on the streets. Our team had been, who he had avascular necrosis in both of his hips, and because he was lying down on the streets for so long, his muscles had all become very stiff, and it was difficult for him to get into a wheelchair, even though he could do that with some pain and assistance. But we had gone through many hoops of trying to get him into housing, and then once we found a housing provider, we went through many hoops with them to tell them why he would be able to function in their environment. And the kind of one of the final steps was getting him from the street to go to an interview at this housing program, and I had not prepared my staff for what this would be like, and we had asked for some volunteers to kind of help out too. And it didn't occur to me at the time to prepare them for, this is just an interview. He's not going to be able to live here now. And the emotional pain that the staff experienced in dropping him back off on the streets in his location was just enormous. And they were so mad at me too. And it was just kind of one of those times that I was like, oh my God, like I knew that he was going back to the streets tonight. He knew that he was going back to the streets tonight, but they didn't. And I think, you know, as much as we can, and maybe for some of us, we're kind of past the point of being able to prepare our staff for this, what this is going to be like. But, you know, as much as we can to kind of say, I think to echo what Drew was saying, to give people warning that this is going to be hard, but that maybe also our friends out on the street are resilient to this themselves, and that while it's really distressing for us to be a part of this really unfortunate system, the things that we can do while they're with us are just to share love and compassion and to say, you know, you're not alone, and this is going to be hard, but it might be harder for our staff than it would be for you know, the person going back to the streets. Does anybody else have thoughts about that or other things you want to share?
Liz, do you mind if I
Yeah.
I wonder whether this is linked to the idea that sometimes our environment doesn't let us behave according to our values. So certainly in UK medical training, where it's all about improving people, right? Improving people's health and moving people from somewhere to somewhere else, presumably better on some dimension of health. Now, sending people back to hospital doesn't really feel like improvement. And I wonder if it's just so counter the way in which we've been educated, but also behaved and valued for such a long period of time, that's maybe why it's one of the expressions as to why maybe it's so distressing.
What else are you guys seeing either in your teams or in your colleagues or even in yourself about kind of responses to things that are happening during the pandemic?
Hi, can you hear me? My name is Dee Dee. Can you hear me okay? Okay. My name is Dee Dee. I'm from New Hampshire. I'm actually one of the providers. We just started street medicine during the COVID, so this is brand new to us. The biggest thing that I found that's been distressing to me, obviously being new at this, is that the shelter that we have that did do the quarantine and they're all out in the streets now, they're not allowing people to come back into the shelter, which is kind of distressing because now people are literally living, you know, sleeping on the benches in the alleyway. They don't have any tents or anything like that. So I did reach out to the administrators and asked if we did get some funding so that we can help and get some tents and stuff. Well, that just opened up a big can of worms. You know, we had a boatload of people coming to our door in the clinic asking for tents. So the city gets involved and all that kind of stuff. So that was kind of like that was a stressful time to see, you know, people, you know, needing just cover. They just needed something to stay out of the rain. They just needed a sleeping bag to stay warm because they couldn't go into the shelter. And I'm going out there and seeing them in their new tents that we're providing. But then I find that they're coming to the clinic more because we're the only ones that are kind of like available. So it is causing a lot of, you know, a little bit of stress, you know, for both of us, for both the clients and the staff. But it is fairly new. It's just happened this past week as far as clients not going back to the shelter. So I'm really glad that Drew and Richard brought up the, you know, how are they responding and how are staff responding, because I think that's something that we need to bring to light to administrators to make sure that they watch out for the staff, especially the staff. I really worry about the staff because this is very stressful for all of us, you know. But thank you for bringing that up. But yeah, that's all I have to share.
Does anybody have thoughts or a response for Dee Dee? Thanks for sharing that.
I did, but I see Anne has her hand up. I'll wait afterwards.
I'm trying to navigate between all of you. Oh, I think you're muted. Hold on, let me unmute you. Anne, can anybody else hear Anne?
No, I think Anne's muted.
She's unmuted now. No, I don't know what's going on. Do you want to type in the chat and we'll come? Maybe you had more than you wanted to say. Okay, all right. Sorry. Jarrell, do you want to
Sure.
share
Yeah.
your thoughts?
Yeah. Thank you. First, I'm Jarrell. I'm the executive director of Light of Life Rescue Mission in Pittsburgh, and so we have been navigating, a lot of these things that Drew brought up and others. I don't have really much to add to that. It is it's like we feel that we're in the middle when the county is coming up with these ideas of, oh, we have a hotel, we're going to put everybody in a hotel. It's like, hey, have you thought about A, B, and C about that? And they're not. They're just, we don't want to hear that. We just want to get to this point. And then, okay, once they're there, there's mental health, there's alcohol issues, and have you thought about these things and support? And no, it's so it's kind of like we can see the train going to go off the track, and we are just trying to wave our hands and say, hey, maybe sometimes I feel like if I have enough emails in the system, when the train does go off the track, they'll say, hey, I remember somebody was talking about this. One of the things that we've been turning our focus towards is the telemedicine. It's like suddenly, people are looking at that as saying, hey, this is something that can be used. And I'm trying to look at it in a way, and others in our area with Operation Safety Net, and it's wonderful having Dr. Withers here to be able to say, okay, we'll get on that idea and let's talk about how not only can that work for COVID testing right now, but maybe we can be talking about addressing some of these systemic inequities for healthcare and what's broken in this system. Because still their general approach is, let's just throw more money at the systems that are kind of already with huge holes in them, and we'll put telestations there. And so rather than just saying, we'll say, okay, let's do that, and let's consider the shelters, the camps, the people that, due to the additional trauma of COVID-19, they're not going to come to your federally qualified health centers. And how can we use this to now build an enduring asset in the community? And so there has been some acceptance of that, but it's definitely a challenge. I was relating to both of the graphs that you shared of dealing with the traumatic situation. I'm on that roller coaster. I definitely am more like the second slide, but yeah, there's been a little bit of all of that, and so I don't know if I added much to it, but just thank you for this opportunity. It was good to be able to sit in and listen as well.
Yeah, and Dee Dee, I think for those of you who have just joined our conversation from the webinar, and discussion is going a little bit long, so I apologize about that. But Dee Dee brought up an issue that she's seeing in her community where it sounds like, and you can correct me if I'm wrong, but that because the shelters are kind of closed now or turning people away, that there are people who want to sleep in shelters and can't, and maybe people who have never slept unsheltered before, or never slept rough before, who are now experiencing that for the first time, which I can't imagine what that would feel like, as somebody who's been sleeping in a shelter and then for the first time in my life during the pandemic to have to sleep outside. I think that, and just how hard that is for, the people who are having to sleep outside for the first time, or people who are having to go outside and don't want to. And then also the staff who are having a really hard time with seeing that happen too. I think that again, and looking towards like building that muscle of resilience. And granted, I think maybe this isn't the best part of the silver lining at all, if there even is a silver lining, but in some ways, I think that shelters right now are maybe one of the worst places to be. And just in the sense of like risk of contracting coronavirus, because in those closed environments, people are, even if their beds are distanced, they're all touching the same faucet handles, they're all touching the same doorknobs and things like that. And then it may be from a disease transmission standpoint that it is safer for people to be sleeping outside. Now, that doesn't make us or necessarily them feel any better when they don't even have, you know, a blanket or a tarp or a tent to put over their heads. But I also think that one of the parts of what Dee Dee brought up is that it sounds like there was maybe a decent community response of providing tents and tarps and blankets and things like that to people. And that while this is a really distressing time, there's also so much to have gratitude about, and to see our community coming together in a way that maybe they haven't before for our unsheltered friends. So again, maybe that's just a little bit of salve on the open wound, but I do think that there are, as we look to those silver linings and to the hopeful parts of this, that that we can find little nuggets to hang on to, I think, that give us some hope. I want to go ahead and transition to just our social time, and you guys can all